Saving life is the most challenging job medical workers experience daily. Dr. Brian Kasaga is a medical intern in his final year of training at Mulago Hospital. At the time of my visit this afternoon, he and others were working tirelessly to save a toddler, Moses Chibuka. Unfortunately, this boy passed on. Dr. Kasaga and his colleagues were demoralized by the incident, but they soldiered on to save more lives.
Because I'm over there on duty, so I'm always there. I provide that emergency care. Even if it is you, God forbid if you get like an accident, I'm going to be there on casualty waiting for you to save your life. I'm ever there.
This is what doctors experience to try and live up to the Hippocratic Oath, which requires that they enforce ethical standards despite poor pay.
They are ever there on the ward from morning, evening, even during the night. Even in those wee hours of the night when people are sleeping, an intern is ever there on duty, ready to work on that Ugandan who comes in with an emergency, whether surgical, whether they've had an accident, whether they have a medical complication. We are ever there. We are not about money. We want to serve. We've been people who have been excellent. We are passionate. We are highly motivated. From our first year, we've been wanting to serve our Ugandans to improve their health status.
On Wednesday this week, Intern Doctors announced a sit-down strike which was meant to commence yesterday. And by Thursday evening, government had responded to their plea, but only 1 month payment was released out of the 3.
They did not provide us with rent. They did not provide us with lunch, transport, airtime, and other allowances. So you find yourself that you have to pay for all these allowances. And usually they give us an allowance of, it's about 700,000, but it never comes on time.
Dr. Ekwaro Ebuku is the president of the Medical Association.
When the doctors are just getting out of school, they are mistreated during their internship, which is their first year of work. You don't pay them, they don't have accommodation.
Sometimes the drugs are not there and the patient really needs some drug and it's not there. You have to tell this patient to go out to a pharmacy and buy it. Otherwise, you cannot do much.
Maybe the problems we faced here in the Mulago is just the gloves and medicine. But for the doctors, they work their works.
You're working on the ward 24 hours, but you don't have even what to eat because you're not being paid by these allowances in time. And call your mother or father to give you something such that you can feed. It's really very frustrating.
Dr. Ekwaro is concerned that Parliament has deviated from addressing people-centered issues to focusing on politics.
As you see, others driving Prados, fuel, they are flying out, picking per diem, and now discussing age limit, distracting the country and investing unnecessary resources, deploying soldiers in town, instead of deploying doctors and midwives to fight the real problems in society, and teachers anyway.
To tell your MPs, to tell this government to stop joking with things of health. You have to inject more money into health. First of all, even the conditions we are working in are also not good. Protection facilities, the medicines are not there. So people out there, you tell your government such that they can provide these facilities, whether lab facilities, whether the medicines.
Last week, the State Minister for Health, Tharo Pendi, arrested medical workers at Naguru Hospital on allegation that they were extorting money from patients. But Dr. Ekwaro Ebuku accused Opendi of exceeding her mandate.
What the minister brought out is nothing new. And at a ministerial level, we think that that was not appropriate.
Jingo Francis, NTV, Weekend Edition.